Live to the Health Minister. We've got a coronavirus update.
114,000 officially recorded cases and confirmed. 107 countries, including Bangladesh and Albania, amongst other new countries that have been confirmed with their first case. And within Australia, we now have 100 officially confirmed cases, and it continues that sadly there have been 3 lives lost. In terms of major developments, we have today, the Prime Minister and myself, through Professor Murphy, have requested the medical experts to review the status of Italian travel advisories. We have done that obviously on the basis of the growth in cases over the last 48 hours in particular, and with regards to Italy's own decisions. That advice will be forthcoming over the course of the next 24 hours. Secondly, the Attorney-General and Industrial Relations Minister, along with the Chief Medical Officer, have met at a roundtable with employers and employees to discuss maintaining workforce and helping those people who are within the workforce that at some stage are affected by the virus in terms of their continuity of employment. I think that's a very important part of preparedness, but also in terms of equity. Thirdly, we are now in the advanced planning and design phase for telehealth items. Those are currently being consulted on with the sector. We want to thank them for their work. The CMO led a roundtable on Friday, the day after the Prime Minister confirmed that we would be developing that and pathology items to assist in bringing the private sector into provision of pathology services. So all of those, I think, have been extremely important developments. We continue to work with the medical community, and I want to again thank them. As I said on the weekend, if over the summer the firefighters and emergency service workers were our national heroes, over the coming months our medical workforce, our health sector, will be the heroes. We owe them a great deal, and our job is to assist and to support them. And I want to thank all Australians for their part. Brendan?
Thank you, Minister. So the principal development internationally has been the situation in Italy with, as Minister Hunt said, substantial increase in cases, but also a very substantial increase in deaths, unfortunately, which would suggest that there is a very large outbreak in Italy, and that's prompted the Italian authorities to take some fairly significant measures. As you know, they've extended their controls beyond just the northern outbreak region, and they've taken a lot of measures, the sort of measures that a country should take to try and contain and delay further spread. In Australia, our situation is very much the same as it's been over the last few days. We have continued to have some cases that have come from contacts of imported cases, some small continued cases imported from a range of countries, and some additional cases from the community transmission event that's happened in northern Sydney. New South Wales and Sydney is still the significantly biggest part of our outbreak in Australia, and clearly New South Wales Health is doing a huge amount of work to track and control the outbreak. As the Minister's also said, we've been working very closely with the health community generally, the whole of the health system, in preparedness and planning, and to move to a new phase with, as the Minister said, telehealth items and the like. So I should probably repeat again, because there has been some confusion in the minds of some about who should be tested. There have been people requesting COVID-19 tests who don't currently warrant the testing. Our focus at the moment is testing people who are return travellers who have acute respiratory symptoms, cough, sore throat and the like, and contacts of confirmed cases. The Australian Health Protection Principal Committee will be making a recommendation about whether healthcare workers should also be tested in some circumstances, but that recommendation is still to come. But at the moment, we are not recommending that general members of the community with acute respiratory symptoms, colds, flu and the like, be tested. So I think that's a really important statement. It may happen at some stage in the future if we have more community transmission than that one episode we've got. But at the moment, we are not recommending people with acute cold, flu-like symptoms, unless they are a return traveller or unless they are a contact of a confirmed case, be tested. Thank you, Minister.